Good afternoon. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm going to talk to you a little bit more about the temporal mandibular joint and the workings and what goes wrong with it. And when it goes wrong, it really gets people. And I have had problems with mine myself. I've hit skin and knocked the fool out of my joint, and I've had some problem with it, but it still has the disc in it, and it functions easy and nice and doesn't give me any trouble unless I abuse it a little bit, and then it'll start hurting. But when it hurts, it really hurts. I mean, you can't even get close to it. And I've had patients that have been hurting with this pain in their jaw, except it's not just in their jaw, it's actually gets over in their neck and their shoulders and their headaches, all kinds of pains that come up from this. And all I can figure out is that this pain spreads out after you've had it for a while, and if you've got something that hurts when you use it, like every time you swallow, you have to bite together, and if the condyle presses into this retrodiscal tissue up here that provides the lubricant for the jaw joint and also feeds the joint, feeds the tissue in the joint, and carries out the waste product in it. It's so complicated. I don't really know how on earth it does all of this, but it can get so sore that a person to come in and you just get your finger close to it and know that they don't want to touch it, don't want anything. But what bothers people, and I've talked to my personal doctor, I said, and the physicians frequently don't get trained much in what to do with the temporal mandibular joint. So, and they don't seem to take a big interest in it. Now, I have had patients that had been hurting for months and sometimes years, and they'd have to take so much medication they couldn't hardly do their job at work and thing. And I've got some videos showing you those things. People that are just have suffered with it for years, and the physicians in one particular case, and I'm not running down the physicians, they just weren't taught about that and still aren't. But they look for pain and the reason for it in other places, like the head. And I had one lady spend all of her money doing brain scans and everything, trying to figure out why her shoulders, her neck, and her head and everything was hurting, and they never did reach over and touch the joints, you see. So if you have pain with it, put your finger on the joint. Now, if you put your finger right up in front of your ear, just in front, and open and close, you can feel the joint open and close. The condyle will move down and come back up like this. And normally there's a disc or a tissue is in between that flows, and there's an upper joint space and a lower joint space, and the liquid, the lubricant that lubricates this is squeezed into the upper joint and the lower joint spaces, and that also carries the food stuff for the portion of the disc that doesn't have any nerves or blood vessels in it. I'll get onto that in a minute when we're showing you the picture of that. So anyway, this is what we're going to talk about for a few minutes. Now, the title up here, it really has been the most gratifying thing to me in dentistry and orthodontics and everything, to find somebody that had been hurting for a long time and have come in about that, and you touch that joint, and regardless of all these other things that hurt, that's where it's coming from nearly 100% of the time. Now, you can have it coming from different sources. It's possible, but I've not run into that problem. If you touch the joint and it's hurting, and you've got headaches and shoulder pain and pain all over, then that's the one you correct first. And it is amazing how this little, what we call the disc, holds up. Now, I won't show the disc in these pictures, but I have shown you in these cut downs of the actual cadavers, and we've got a slide on that. You can see the disc and everything, and I'll draw it out for you a little bit as we go along here. So anyway, let's get going on this, and I'll have to get my little arrow going back again, it looks like. Okay, this is we've got a skull here that I purchased this, if I'm not mistaken. I bought a dentist, bought everything he had. He retired and he had passed away, and his wife sold his stuff. And if I remember correctly, this was in it. I don't remember exactly, but I've had this skull for probably 60-something years, and you can't buy them now. But this thing is the real thing. I don't know why they've got some rule that you can't use the real thing now, so you see all these plastic skulls, people trying to show you things. And there's just so much to the skull that you can't possibly make a plastic model of it and have it show like this. It gets down into all the detailed things about this. Now, we're going to be talking about this fossa right up here is where the condyle works, and this is the condyle right here. And you think about it a lot of times as a kind of a ball, but it's not. It's more of a football shape out here, and the muscle is attached in here, comes down, the masseter and the temporalis muscle comes down and pulls this jaw up, and this is one muscle that too many of us exercise it too much. We eat too much and then way too much. So this is the thing that we're going to be talking about today. Now, the condyle doesn't fill all this space. You see the space back in here. And you can look at this, got a video on where some guys from Finland, I believe, or Norway, cut down some cadavers, and they have it opening and closing, and they have this condyle, and you can see this tissue, how it's wadded up in here. And that has to be where the synovial fluid is formed. Now, it's highly vascular. I mean, it's got a lot of blood vessels and blood supply, and it has nerves in it and everything. And how it works is just a miracle. I don't see how the Lord provided that for us. And it makes a synovial fluid, which is the slickest stuff we know about, and it lubricates the joint. Now, I'll be 94 years old here in April, and my jaw still functions good. It doesn't make any noise. The disc is still alive and in there, and it's lubricated, and it moves good, and it's functioning good for something that'll last that long. We can't make anything. We've tried making things and put them in there, and they were dangerous. They ate into the brain on some of the things we tried to build false discs and all this. So they've abandoned that. We don't try to make any false discs anymore. Now I'm gonna have to move on here. I'm taking too much time with them, but this is just a little closer up view of it. And the force right in through here is where the muscles are pulling up and down in this area. And if you bite out here on your front teeth, I don't have them in the picture right here, but you measure this distance from here to where the muscles are, and from here to where the muscles are, and it's about 3 or 4 times further out here from the muscles than it is from here to the muscles. Now, if you decide you want to bite something off, just a sandwich or something like this, just put your fingers up here on your condyle, on the head of the condyle, and you reach out and bite with your front teeth. And as you do, if your teeth are set up right, where you've got a little overjet and overbite, and now I open my mouth and I bite a sandwich off. When I bite that sandwich, there is nothing touching in any of these teeth back here in the mouth. The pressure is right on your front teeth and right on this disc right here. Now I hadn't thought of that. Well, if you just put your fingers up here now, bite with your front teeth. There shouldn't be any teeth touching in there. If there are, your occlusion is messed up. Now, also, if I bite to the side, say I'm going to chew on the left side of my mouth over here, this condyle stays in the fossa, but the one on the right moves out of the fossa. Your jaw moves this way. So this condyle cannot be just a round thing like that. It has to move from back and forth the way you chew like this. And so the ends of it are kind of rounded off, and it's shaped a little like a football, not totally, but that allows it to stay in the fossa on one side, and it'll be out on the eminence on the other side. This is a complicated thing, how it works, and it works with the teeth over here. And you can do things to the teeth the way they meet together and screw this thing up, and if the very idea that dentistry or orthodontics or anything else has no effect on the TMJ is just a bunch of bull. It does in many places. Not only that, just the nervous system. You can get so tense and tied up with something. You don't find that too often, but I had one patient once that we could not do anything to keep this from hurting. And finally I asked her about her work, and she said, well, her and her boss didn't get along good. They were at each other's throats all the time, fussing about something, and she was under such stress that we couldn't get the jaw to quit hurting. So she changed jobs and got some work that she enjoyed or got along good with the boss anyway, and this thing quit bothering her. Now that's the only case I know of that just stress alone, but stress puts a part into every jaw. How much you grind your teeth and press on them, and you bite down harder and grizzle, you put a lot of force on this and damage this part of it. All right, let's move on to some other parts of it. Now, this give you a little more angle of it. By the way, this is the ear, and the bone structure between the ear and the fossa, where this opening right in here, and this is the eminence where if I bite on one side, the condyle will move out here, or if I open my mouth very wide and bite something, the pressure will be out in this portion right there. I don't have the picture of the disc in there in this video, but I should. Your disc, well, let me get to a condyle and just show you that. Now this gap is open, but this condyle doesn't go up in this part. That's where this retrodiscal tissue comes up in there. Now if you get hit in the jaw, and if you don't have a mouthpiece in there, it can shove this condyle where it's coming in contact with the disc here, but it can shove it back in this area so far, and it'll damage it. It'll push the whole disc out in front of this thing, and it'll land out in this area, and then you open it, it'll click back up there, and that's where your clicks come from. And you can't stop them from clicking unless you can pull this back up here and suture it back to the head of the condyle. There's a real good old surgeon in Dallas, Dr. Larry Wolford. I worked with him on cases, and he sutures this disc back by driving little staples in here with the thread on them. Then ties that disc back and gets it done, and his work holds up much better if he does that. All right, let's go on. We got so much to talk about here. I won't be able to finish it in a length of time. Now there's the blown up of it a greater, and now this is just the jaw itself. I wanted to show you the heads of the condyles are kind of shaped like a football in a sense. You don't have much off here, but it kind of curves in on each side, where when you move your teeth from side to side, the condyle couldn't be just a straight bar across there. It has to twist in there. You can feel it doing it when you do that. And this is just the jaw, and it's taken apart here. So let's get on with some other things about it. Now here is the condyle, just the condyle. And this is the part that goes toward the center, and this is the outer portion in here. And it's very much like a football, except on this side over here where it's attached. But the disc has to rotate in the fossa, and the fossa is not just a round place, but it's worn off so that the disc can turn in there so that you can chew like you should be able to grind back and forth when you're chewing. It's about 4 times more efficient to chew where you can slide your teeth back and forth rather than chew straight up and down. Now people that have a deep closed bite, they can't do this side motion, but they just have to chew like a dog. The cow's the other way. The cow will move back and forth, but they don't have teeth on one area of the mouth. So the human being is made to function with eating different things. We eat meat, and we eat vegetables, and we eat all kinds of stuff like that. And we're able to chew things like that for years and get by with it. All right, you're looking at it from the front or the back. That'd be the back. You can see now the disc fits up in this part, and this portion of the disc right in here where it takes excuse me, takes all the pressure. There are no nerve endings, and there are no blood vessels. And you know, how in the world does that tissue live all your life in there? The edge of the disc is thicker out here. It doesn't go under the pressure area. And so there are blood vessels in that area of this, but this fluid that goes in here supplies the food and takes the waste product out and back into the blood vessels, and the body purifies it and keeps it. And this has been functioning in my own mouth now since I was well, it's been there all my life, really, before I was born. So it's been in there 90 some odd years and is still functioning quite well. Now that's, to me, is just a miracle how it does that. And I wanted to tell you that people doing dentistry, I don't care if you think you're not getting involved with temporal mandibular joint problems, you are. But you may not know it, but you have effect on them. Now this is the way that fits up into the fossa to some extent. And there's just another picture of the jaw. And you see this was lying here, this was a little bit out of focus, but the jaw can go back and forward, and it can go to the front and sideways. And so I examine everybody you work on, see if they can open their mouth, how wide they open it. And if they open it part way and it'll click, then that disc is off out in front of the condyle that's got pushed out there. And I have people that go out and they go, and they'll kind of hold on one side there, and then their jaw straighten up, and they go down further and get one on the other side. And getting them back on is a problem, and you can't get a lot of them on. If you get them when they first get damaged and get it back on and wear a splint that forces you to keep your jaw forward and doesn't let it click, then sometimes they'll grow back that way. So anyway, let's get on. There's just so much to learn about this thing. There it is again now. All right, I'm looking at the skull just upside down, and here is the fossa where the condyle works. Over on this side, they stuck a piece of felt in here that kind of fills in, and because when you put the teeth together out here, there's a space in between the condyle and the fossa, and it doesn't touch because that's where this disc fits, and the disc just slides with the condyle as it opens and closes like this. And if you let something hung with it, or if you hit it and get any damage to it really hard, it'll get sore and you'll quit using it. Now, I have come to this conclusion that the reason we get pain in our neck and head and shoulders and chest and all around is that the thing gets sore and you use it, and you can't stop using it because every time you swallow, it bites, it presses on that disc. And if you chew on it or you're irritated and you keep irritating it and the thing keeps hurting, and finally the pain seems to come from all directions. And I found out just recently from my granddaughter, who's in music and everything, the singer, that if your vocal cords get inflamed and you keep speaking or using or singing or whatever you're doing is irritating your vocal cords, you'll get pain in the head and the shoulders. And she described the pain from the vocal cords. It's almost exactly like the pain coming from the temporal mandibular joint. And what it is you're using something that is in bad shape, and it's trying to tell you, but people can't tell where it's coming from. So people just have to stop talking or things and let it rest up. And in your jaw, You just have to do something, eat things you don't have to chew much, and try to swallow and stuff that way if it gets sore. But actually, we found out if we advance the mandible on people like that, get this condyle out in front of the disc, that this will stop hurting. And so we'll talk about that later on here. Now this was like a lot of things I do. I'm upside down, but you can see the fossa right here, and here is the ear, and the bone structure between these two. If this gets really inflamed, your ear will hurt, and you'll hurt a lot of different places in there. Let me go ahead, and now I think we're just about where we want to. This is a close-up of the fossa. We're looking down into it, and so you can't tell the depth, but that's where this condyle fits, and that's where it works, right there. Now, there's just a close-up of the fossa, and when you put your jaw forward or when you open, the condyle gets up on top of this thing, and then when you close, it'll come down in here, and this synovial fluid is taken care of back in the back part of that. And there's a little piece of felt they put in on the skull to show you that's about how thick the disc is. And we'll cover some other things now. There's so much in here. The cortical bone and the cancellous bone is just something you really need to understand. Now, if you're putting these little screws in the bone, and expect to use them properly, you got to get them in cortical bone. Excuse me. Now this shows where they are, and when you bite with your front teeth out here, nothing touches here until you hit here and you hit here. So if the muscle is right down in this area right here, the masseter and the temporalis muscle are the main ones closing out here. And if you bite with your front teeth, in other words, you're going to shift your jaw to where these teeth are closing out here, it'll bring this condyle, this is out a little bit right now, here. If you bite with 10 pounds of force out here, and this is 3 or 4 times further from the muscle, this joint and the one on the other side is going to have a lot more force than that. So this tissue that's in there, it has been in my mouth for over 90 years now, and it's still good. It's tougher than heck. I don't know how it holds up that way. And it takes a tremendous load. It's so much load that blood vessels and nerves do not grow and stay in that tissue. They are in the tissue out around the side of it where it's thicker. It's kind of like a two-faced thing. It's kind of hollowed out on the center in there. So I'm going to go a close-up on this, and we're trying to get everybody who pays any attention to these things to get some idea of how this thing works and what it does. And if you get this damaged back here and you keep using it damaged, it gets hurt. It'll hurt the whole head, shoulders, neck, and all down there. And people, a lot of times medical people do not know where they're coming from. They're other places. They're beginning to know more about it now than they used to. So I'm going to say goodbye, and we'll put our little deal. I hope you'll join our group here and subscribe to our channel. So we appreciate your watching.